Okay, to begin, level of consciousness 1A. We will start with demonstrating a normal score.
Hello, David.
Hello.
I'm Dr. Hopian. How are you?
I'm very good.
Are you in any pain?
I'm not.
Now, level of consciousness 1A, a score of 1.
David, hello. Hi, I'm Dr. Hopian. How are you?
Okay.
Are you in any pain?
No, I'm not.
So that was drowsy but easily rousable. Now we will demonstrate a score of 2.
David, hello. Wake up. It's Dr. Hopian. Open your eyes. Open your eyes. Open your eyes. Hello there.
Oh.
Hi, it's Dr. Hopian. How are you?
I'm okay.
Are you in any pain?
No.
So this is a score of 2, not alert, but requires repeated stimulation to attend or is obtunded. Now we will demonstrate a score of 3.
David, hello. Open your eyes. It's Dr. Hopian. Open your eyes. Open your eyes.
So this is demonstrating a score of 3, responding only with reflex motor or autonomic effects, or indeed totally unresponsive. Sometimes you may see the patient posture with deep stimulation.
David, open your eyes. Open your eyes.
Again, this would score a score of 3. Next, score section 1B, level of consciousness questions.
Hi, David. Can you tell me what month we're in?
It's June.
And how old are you?
I'm 31.
Both questions were answered correctly, so this would score 0. Next, demonstrating a score of 1, which would be 1 question answered incorrectly.
What month are we in?
I think it's April.
Okay. And how old are you?
I'm 31.
So the month was incorrect, the age was correct, scoring 1. Next we will demonstrate a score of 2, where both questions are answered incorrectly.
What month are we in?
I think it's January.
And how old are you?
I'm 27.
Now we will move on to item 1C, which is level of consciousness commands. First we will start with demonstrating a score of 0, where both commands are followed correctly.
David, I'd like you to close your eyes. Open your eyes. Make a fist with your right hand. Open your hand.
Now we will demonstrate a score of 1, where 1 command is answered correctly and 1 is incorrect.
David, can you close your eyes? Open your eyes. Make a fist with your right hand. So I want you to make a fist with your right hand.
So the action can be pantomimed, but it's still not followed. But do not put your fingers in the patient's hand as you're trying to assess if the patient understands the command. Next, we will show a score of 2, where both commands are not responded to correctly.
David, I'd like you to close your eyes. Can you close your eyes? Close your eyes. Okay. Can you make a fist with your right hand? Make a fist with your right hand. For level of consciousness questions, aphasic and stuporous patients who cannot comprehend the questions will score 2. For patients who are intubated or have unintelligible speech from severe dysarthria or who are of non-English speaking background will arbitrarily score 1. Only the first attempt at answering the question is scored.
Next, we will move on to item 2, best gaze. We will start with demonstrating a normal score of 0.
For this, we're looking at horizontal movements of the eyes. David, I'd like you to look at my finger and keep following my finger all the way to the left and all the way to the right. David has full lateral movements of his eyes.
Next, we will demonstrate a score of 1, a partial gaze palsy or gaze preference.
David, I want you to have a look at my finger and keep following my finger all the way to the left and all the way to the right. All the way to the left and all the way to the right. David's eyes cross the midline, but they don't go all the way across to the left side. David has a partial gaze palsy, which is scored a 1. David has a gaze preference to the right at baseline.
Next, we will move on to demonstrating a score of 2, a forced gaze deviation.
Again, David has a gaze preference to the right. David, I want you to have a look at my finger and follow it all the way to the left. David's eyes did not move. I'm going to perform the oculocephalic maneuver to see if we can get his eyes to cross the midline with a reflex maneuver. So, just going to turn your head from side to side, and David has fixed gaze deviation to the right.
So the crucial thing is to see if the eyes cross the midline. In this case they did not, so confirming a forced gaze deviation and a score of 2.
The strokes that are not within the middle cerebral artery territory, for example posterior circulation strokes, where a single eye may have a cranial nerve defect, such as a cranial nerve 3 palsy or a fourth nerve palsy, this is an arbitrary score of 1. For patients who are comatose or cannot follow commands because they are aphasic, you can demonstrate lateral eye movements with the oculocephalic reflex.
Next, we will move on to item 3, visual fields, and we will start by showing you the positioning for the examiner and how to assess the visual fields to direct confrontation for a normal score of 0.
David, we're going to have a look at your peripheral vision. I'd like you to cover your left eye with your palm and look into my eye. Don't look at my fingers and tell me how many fingers I'm holding up in total without looking at them.
1, 2, 2, 1.
So for this, we are testing both upper and lower quadrants, and we're keeping close to the midline. Usually 1 or 2 fingers should suffice on each side. Now I'd like you to cover the right eye with your palm, look into my eye, and again tell me how many fingers I'm holding up without looking at them.
1, 2, 1, 1.
David has full peripheral vision in both eyes, so he scores 0.
Next, we will demonstrate a partial hemianopia, more commonly known as a quadrantanopia. This may either be a homonymous superior quadrantanopia or a homonymous inferior quadrantanopia. Both would score 1.
1, 2. I'm not sure. 1, 1, 1, 2. I'm not sure.
David has a left superior quadrantanopia, which is a score of 1.
An important point is always to make sure the patient remains focused directly straight ahead on your face and is not using their lateral eye movements to count the fingers. Next, we will move on to demonstrate a score of 2, a complete homonymous hemianopia.
1. I'm not sure. I don't think I see anything. 2. I don't see anything.
Cover the right eye now. Look into my eye. How many fingers do you see?
1. 1. I don't see anything.
David has a left homonymous hemianopia or hemifield cut. This is a score of 2.
So correct positioning for assessment of the visual fields is to be at eye level and roughly 1 meter apart, but it's important to keep the patient directly focused straight ahead. Lastly, a score of 3 will be given for a patient with a bilateral hemianopia or complete blindness, which may be from cortical blindness. If a patient has pre-existing blindness, they will still score 3 on the NIH, because you should always score what you see, but this would be annotated in the notes to explain that it is pre-existing.
For patients who are aphasic and cannot comprehend or count fingers, visual fields can be tested with visual threat in each of the 4 quadrants. The normal response is to blink. In this case, David blinked to visual threat on the right side, both upper and lower quadrants, but he did not blink on the left side in either upper or lower quadrant. This means he has a left homonymous hemianopia or field cut, and this is a score of 2.
Next, we will move on to item 4, which is an assessment for facial palsy. First, we will demonstrate normal symmetrical movements, which would score 0.
David, I'd like you to raise your eyebrows. We're looking at the symmetry of the forehead furrow. Don't let me push it down. And the strength is normal. What I'd like you to do now is squeeze your eyes tight shut and don't let me open them. Good, open your eyes. Show me your teeth. We're looking at the symmetry of the smile. Relax your mouth. We're also looking for flattening of the nasolabial fold. A score of 1 for facial palsy would be some minor flattening of the nasolabial fold or very mild asymmetry of the mouth with smiling that the patient's spouse or next of kin says is not pre-existing. A score of 2 is when you see an obvious facial droop. The mouth may be drooping on one side and does not rise when the patient grins or smiles. A score of 3 is a lower motor neuron 7th nerve palsy on one side or bilateral 7th nerve palsies. When a patient is comatose or aphasic and cannot comprehend commands, you may test the facial nerve by giving a painful stimulus and looking at the symmetry of the grimace.
Next, we'll move on to item 5 and 6, assessing for motor arm and leg weakness on the right and the left side. We will start with the upper limb. The limb is placed in the appropriate position, which is to ask the patient to extend their arms palm down at 90 degrees if sitting or 45 degrees if supine. It is important to score each arm individually and see if the arm can be extended for 10 seconds. The cadence of the count should be a regular 1 per second. We will start by demonstrating a score of 0, normal power.
David, I'd like you to hold your arm up for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. David was able to hold his right arm up for a full 10 seconds and there was no drift of the arm. This is a score of 0.
As demonstrated, it is often helpful to pantomime the gesture in case there is any difficulty with comprehension. Now we will move on to demonstrate a score of 1, which signifies drift, where the arm drifts down before the full seconds but does not hit the bed or any other support.
David, I'd like you to lift up your left arm and hold it up for a full 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. David shows some drift of his left arm but is able to maintain anti-gravity strength throughout the entire 10 seconds. His arm does not fall or hit his lap or any other support structure, and this is a score of 1.
Next, we will demonstrate a score of 2. This is where there is some effort against gravity. The limb cannot get to or maintain, if cued, 90 degrees, drifts down to the bed, but has some effort against gravity.
David, I'd like you to lift your arm up and hold it up for the full 10 seconds. I'm going to let go now. Hold it up. 1, 2, 3, 4, 5, 6. So David has some anti-gravity power, but is not able to maintain it for the full 10 seconds, and his arm drops and hits the bed. This is a score of 2. On some occasions, when the patient has at least moderate weakness, as in this case, you need to help the patient by lifting up the arm initially.
Next, we will demonstrate a score of 3. Here there is no effort against gravity and the limb falls, directly hitting the bed or the nearest support.
David, I'd like you to lift up your arm and hold it up for a full 10 seconds. I'm going to let go now. So the arm drops immediately. David does not have anti-gravity power of the left arm. I'd like to see if he has any non-gravity dependent movement of the arm, which would distinguish this between a score of 3 as opposed to a score of 4, where there is no movement in the arm. David, can you wiggle your fingers or move your arm at all? David is showing a few flickers of movement in his hand, so I would score this a 3. If there was no movement in the arm, this would be scored a 4.
Next, we will move on to power and strength testing of the lower limbs. For this scenario, the leg is held at 30 degrees, the patient is always tested when supine, and is only held in that position for 5 seconds. The principle of the scoring is identical to that in the upper limb, which we will quickly demonstrate now.
David, I'd like you to lift up your left leg, good, and hold it up for 5 seconds. 1, 2, 3, 4, 5. Good. This is a score of 0. David was able to maintain the position for the full 5 seconds without any drift. I'd like you to lift up your leg again. We're going to demonstrate a score of 1. 1, 2, 3, 4, 5. As you can see, there's some drift of the leg, but the leg maintains anti-gravity power for the full 5 seconds. Now we're going to demonstrate a score of 2. David, lift up your leg again. I'm going to count to 5. Keep it up. 1, 2, 3, 4, 5. As you can see, David had anti-gravity power but could not sustain it for the full 5 seconds, and the limb dropped and hit the bed. That's a score of 2. Now for a score of 3, there is usually no anti-gravity power. David, I'm going to lift your leg up, and I want you to keep it up for the full 5 seconds. As you can see, the limb drops straight away. I'm going to see now if he has any non-gravity dependent movement. David, I wondered if you could move your foot or your leg at all in the bed. Okay, so he's showing some lateral movement of the leg, but no anti-gravity power. Seeing as there is some non-gravity dependent power, the score is 3. Now we're going to demonstrate a score of 4. I'm going to lift up your leg. I'd like you to hold it up for a full 5 seconds. Again, the leg drops. I'd like to see if you have any movement in the leg. Can you move it at all? And there's no movement. This is a score of 4.
Now we will move on to item 7, limb ataxia. This item is aimed at finding evidence of a unilateral cerebellar lesion. Test with eyes open. In case of visual defect, ensure testing is done in the intact visual field. The finger, nose, finger and heel shin tests are performed on both sides, and importantly, ataxia is scored only if present out of proportion to weakness. Ataxia is absent in the patient who cannot understand or is paralysed.
David, I'd like you to touch my finger with your index finger, and then your nose, and go backwards and forwards. Good. Let's use the left side now. Touch your nose. Touch my finger. Good. David, David has intention tremor and sometimes misses the target. He has ataxia present in his left upper limb. This is so far a score of 1.
Now we will demonstrate testing for ataxia in the lower limb with the heel, knee, shin test.
David, I'd like you to put your right heel on top of your left knee and run it down and up the shin as neatly as you can. Good. Let's try the same thing on the other side. Good. Let's try that again, but this time show what ataxia might look like. Okay, enough? Good, thank you. Ataxia is either absent, which is a score of 0, present in one limb, which is a score of 1, or present in 2 or more limbs, which is a score of 2. Remember that ataxia has to be out of proportion to the degree of weakness.
Next we will move on to item 8, which is testing sensation. This should be tested in the face, arm and leg, and should be testing for a grimace or feeling to pinprick when tested, or withdrawal from a noxious stimulus in the obtunded or aphasic patient.
David, I'm going to touch you with something sharp on either side of your face, your arms and your legs. I want you to tell me if it feels the same to touch on both sides. Here I'm testing V1.
It's the same.
Okay. And V2,
Same.
V3.
Feels the same.
Remembering that a single stimulus on either side should suffice. Now I'm going to test the arms. Does this feel the same as this?
Yes, it does.
And the legs?
Feels the same on both sides.
Okay. I generally avoid the peripheries so that there's no confusion with pre-existing peripheral neuropathies.
Now we will demonstrate what would score 1 for mild to moderate sensory loss.
David, I'm going to touch you on both sides of your face, your arms and your legs, and I want you to tell me if it feels the same to touch on both sides.
No,
What's different?
I feel it more on the right.
Okay.
It's stronger on the right. Same, it's stronger on the right. Feel more on the right. It's the same, it's more on the right.
So I want you to close your eyes. Can you feel me touch you at all now? Am I touching you?
Yes.
Okay. So David has reduced sensation in the left face, arm and leg, but it's not total or severe loss of sensation. This is a score of 1.
Now we will demonstrate a score of 2, representing severe to total sensory loss where the patient is not aware of being touched in the face, arm and leg.
Does it feel the same to touch on both sides?
No,
What's different?
I only felt it on the right side. I only feel the right side. Just the right. I couldn't even feel that. Again, feel that. Not feel anything there.
Okay. Close your eyes. Am I touching you now?
No,
What about now?
no,
What about now?
yes, my right leg.
So David has severe sensory impairment on the left side. In fact, he has hemianesthesia. This is a score of 2.
A score of 2, severe or total, should only be given when a severe or total loss of sensation can clearly be demonstrated. Stuporous and aphasic patients will therefore probably score 1 or 0. The patient with brainstem stroke who has bilateral loss of sensation is scored 2. If the patient does not respond and is quadriplegic, the score is 2. Patients in coma, which is item 1A, scoring 3, are arbitrarily given a 2 on this item. Now we will move on to item number 9, best language. A great deal of information about comprehension will have been obtained already during the preceding sections of the examination. The patient is then asked to describe what is happening in the attached picture, the cookie theft scene. They are asked to name the items on the attached naming sheet, and then they are asked to read from the attached list of sentences. If visual loss interferes with the tests, ask the patient to identify objects placed in the hand, repeat and produce speech. The intubated patient should be asked to write. The patient in coma will arbitrarily score 3 on this item. The examiner must choose a score if the patient with stupor or limited cooperation, but a score of 3 should only be used if the patient is mute and follows no one-step commands. A score of 0 represents no aphasia and normal speech. A score of 1 represents mild to moderate aphasia. There will be some obvious loss of fluency or facility of comprehension, without significant limitation on ideas expressed or form of expression. Reduction of speech and or comprehension, however, makes conversation about provided material difficult or impossible. For example, in conversation about provided materials, examiner can identify picture or naming card from patient's response. A score of 2 represents severe aphasia. All communication is through fragmentary expression. Great need for inference, questioning and guessing by the listener. The range of information that can be exchanged is limited. The listener carries the burden of communication. The examiner cannot identify materials provided from patient response. A score of 3 represents the patient is mute. There is global aphasia and no usable speech or auditory comprehension. Next we move on to item 10, dysarthria. If patient is thought to be normal, an adequate sample of speech must be obtained by asking patient to read or repeat words from the attached list. If the patient has severe aphasia, the clarity of articulation of spontaneous speech can be rated. Only if the patient is intubated or has other physical barrier to producing speech may the item be scored 9, and the examiner must clearly write an explanation for not scoring. Do not tell the patient why he/she is being tested. A score of 0 will represent normal speech. A score of 1 represents mild to moderate dysarthria. The patient slurs at least some words and at worst can be understood with some difficulty. A score of 2 is when the dysarthria is severe. Patient's speech is so slurred as to be unintelligible in the absence of or out of proportion to any dysphasia, or the patient is mute or anarthic. Lastly, we move on to item 11, testing for extinction and inattention. Sufficient information to identify neglect may be obtained during the prior testing. If the patient has a severe visual loss preventing visual double stimulus stimulation and the cutaneous stimuli are normal, the score is normal. If the patient has aphasia but does not appear to attend to both sides, the score is normal. Presence of visuospatial neglect or anosognosia may also be taken as evidence of abnormality. Since the abnormality is scored only if present, the item is never untestable. Typically, we test for visual double stimulation and tactile double stimulation. Auditory double stimulation can also be tested but is rarely done in the clinical scenario. We will begin by demonstrating a score of 0 representing no abnormality.
David, I'm going to touch you with a pin on either side of your face, arms and legs, and I want you to tell me if it feels the same to touch on either side.
Feels the same. That's the same. Same on both sides. Feels the same. Feels the same.
Now I'm going to touch you on the right, the left, or both sides.
Okay.
I want you to close your eyes and tell me which side I'm touching without looking. Right, left, or both.
Right. It's the left. It's the left. Both sides. The left leg. Both legs. The left face. Right side. Both sides.
Now we will demonstrate tactile extinction to a double stimulus.
Right. Left. Left. Right. Left. Right. Right. Left. Right.
David can feel each single stimulus on the right and left sides, but when I give him a double simultaneous stimulus, he ignores the left side. In the case of unilateral hemisensory impairment, as long as a single stimulus can be felt, tactile extinction can be tested.
Now we will demonstrate testing for visual extinction. We will begin by demonstrating a normal score.
David, I want you to cover your left eye with your palm, look into my eye, and tell me how many fingers I'm holding up in total without looking at them. So tell me the total number of fingers.
1, 2, 2, 1,
David has normal visual fields.
3, 3,
And there is no visual extinction.
Next, we will demonstrate the findings for left visual extinction.
1, 2, 2, 2, 1, 2, 2, 1, 2.
Cover your right eye now. Look into my eye. Tell me how many fingers I'm holding up in total without looking at them.
2, 1, 1, 2, 2, 1, 2, 2, 2.
David has left visual extinction. When a double simultaneous stimulus is provided, he ignores the left side, even though he has preserved peripheral vision on the left side in both eyes. If neither modality is affected, this is a score of 0. If you have demonstrated extinction in one modality, either sensory or visual, this is a score of 1. If multiple modalities are affected, this is a score of 2. A score of 2 is also given if the patient has hemispatial neglect. This is failure to attend to the contralateral side of the body.